Okay, Chapter 27, Behavioral and Psychiatric Emergencies and Suicides. So, what is it? What is a behavioral emergency? So, behavior, manner in which a person acts or performs. Behavioral emergency is behavior within a given situation that is unacceptable or intolerable to patient's family, or community. So, recognize cultural behavior. We don't have a ton of that around here, but you can have it with people traveling through or some of the people that have moved in. They might have different cultural stuff than you. Behavioral conditions require full patient assessment, and you also need to remain objective. We aren't here to judge anybody. Observe behavior largely controlled by transmitters. So those are inside the brain. Neurotransmitters travel from neuron to neuron. Impulses move across nervous system by this mechanism. So neurotransmitters or lack of neurotransmitters have been implicated in depression and other behavioral and psychiatric disorders. Medications prescribed for these conditions are designed to affect the relevant neurotransmitters. Newer medications offer reuptake inhibitor of more than one neurotransmitter. Psychiatric conditions. Some behavioral emergencies are caused by psychiatric conditions or mental disorders. Almost 1 in 5 adults in the United States have some sort of mental illness. Mental health services declining and are overcrowded. More patients with mental illness are in the community with minimal treatment. This makes it more likely to be seen as a patient by the EMS system. All right. Physical causes of altered mental status. Medical and traumatic conditions that can alter a patient's behavior. Low blood sugar, which we've talked about in the past. If somebody's acting drunk, if they're acting altered, we always get a blood sugar. Always got to. Lack of oxygen. Stroke or inadequate blood to brain. Head trauma, seizures, mind-altering substances, and environmental temperature extremes. So you need to take into account all of those things. Situational stress reactions. Normal reactions to stressful situations produce emotions, including fear, grief, and anger. Caring for patients with situational stress reactions. Do not rush. Tell the patient you are there to help. Remain calm, keep your emotions under control, listen to the patient, be honest with the patient, and stay alert for changes in behavior. Acute psychosis involves a severe break in patients' ability to process information and interact with their environments, often associated with a psychiatric disorder such as schizophrenia. Symptoms include hallucinations, delusions, catatonia, and thought disorder. Ensure safety of patients and responders. All right, emergency care for behavioral and psychiatric emergencies. Range of presentations. Withdrawn, not communicating, talkative, agitated, bizarre or threatening behaviors, and a wish to harm themselves or others. Key techniques. Identify yourself and your role. So you say, I'm Lane with Cheyenne County EMS. I'm here to help you. Speak slowly and clearly. Make eye contact. Listen to the patient. Do not be judgmental. That's the thing to remember. We are not here to judge. Use positive body language. Acknowledge the patient's feelings. Do not enter the patient's personal space. Stay at least 3 feet away from patient. Be alert for changes in emotional status. And use restraint to prevent harm if necessary. And that if necessary is a very important thing because you have to justify that you did it. All right, so rules for interactions. So in this picture here, you plan your approach to the patient in advance and remain outside of the range of the patient's arms and legs until you are ready to act. Note, a fifth rescuer, if available, can control the patient's head, taking special care, however, not to be bitten. So when you have somebody that's having a psychiatric issue, we, need to take special care when we're assessing them, partially for our safety and for theirs. We don't want anybody to get hurt. So in our assessment, perform a careful scene size up. Identify yourself and your role. Complete a primary assessment. Perform as much of a detailed examination as possible and gather thorough history. Common signs and symptoms: panic or anxiety, unusual appearance, disordered clothing or poor hygiene, agitated or unusual activity, unusual speech patterns, bizarre behavior or thought patterns, suicidal or self-destructive behavior, and violence or aggressive behavior. So, patient care. Be alert for personnel and scene safety problems. Treat any life-threatening problems. Consider medical or traumatic causes. Spend time talking to patient. Encourage patient to discuss their feelings. Never play along with hallucinations. Consider involving family and friends if there's any there. Suicide, the 10th leading cause of death in the United States. Depression coupled with successful suicide has reached alarming levels in combat veterans and the senior citizens population. Many more people suffer both physical and emotional injuries in unsuccessful suicide attempts. Anyone may become suicidal if emotional distress is severe. People attempt suicide for many reasons. Potential or attempted suicide. Explore the following possibilities: depression, high stress levels, either current or recent emotional trauma. If you're aged 15 to 25 and 40 plus is the highest risk. Also, drug and alcohol abuse. Potential or attempted suicide. Explore the following possibilities: threats of suicide, suicide plan, previous attempts or threats, and sudden improvement from depression. Your first concern must be your own safety. Emergency care is your scene size up. Identify and treat life-threatening problems. Reassure the patient. Perform a detailed secondary assessment. Detailed exam only if safe. Some people do not want you touching them. Reassess frequently and notify the receiving facility what kind of patient you have, what's going on about them. All right, so think about it. Patient is a 23-year-old male. His girlfriend called 911 after a domestic dispute. He is uncooperative and refusing treatment. The girlfriend reports the patient is depressed and suicidal. He owns a gun and has threatened to shoot himself. So, can you treat the patient if he did not call? Should you believe the girlfriend? Does the patient need treatment or transport? Can you treat and transport this patient against his will? And what should you do? So think about those things with that, because those are all questions that sometimes you have to consider. All right, aggressive or hostile patients. Consider clues. Dispatch information, clues from the scene, information from neighbors, family, or bystanders, the patient's stance or position in the room. Ensure you have an escape route. Do not threaten patient. Stay alert for weapons of any type. Patient assessment. May not proceed beyond primary assessment until patient is calmed or restrained. May spend most of time calming patient and ensuring everyone's safety. Hostility or aggression, never an excuse for not assessing patient as thoroughly as possible. Emergency care. Perform a scene size up. Request additional help if necessary. Seek advice from medical control if necessary. Watch for sudden changes in behavior. Reassess frequently and consider restraints. Reasonable force and restraint. So reasonable force. The force necessary to keep the patient from injuring self or others. Reasonable is determined by the patient's size and strength. Type of behavior. mental status, and the available methods of restraint. In most localities, restraint is within jurisdiction of law enforcement. Never attempt restraint without proper legal authority and sufficient assistance. Excited delirium, extremely agitated or psychotic behavior. Triggers for this condition can include uncontrolled psychiatric illness and/or drug intoxication. These patients frequently develop significant and even life-threatening cardiovascular and metabolic stress. So positional asphyxia, inadequate breathing or respiratory caused by body position that restricts breathing. Carefully monitor all restrained patients. They are in your care. It is your job. So restraining a patient, have adequate help. Plan actions. Stay beyond the patient's reach until prepared. Act quickly. One EMT talks to calm patient. Requires 4 persons, 1 at each limb. Restrain all limbs with approved leather restraints in supine position always. All right, EMT is responsible for restrained patient's airway. Ensure patient is adequately secured throughout transport. Apply a surgical mask to spitting patients if local protocols permit. Reassess frequently. Document thoroughly. Transport to an appropriate facilities. Not all hospitals are prepared to treat behavioral emergencies. Choose correct facility based on capabilities and local protocol. Medical and legal considerations. Consent. Refusal and restraints cause significant medical legal risk. Laws typically allow providers to treat and transport patients against their will if a danger to themselves or others. Know your state laws on treating patients without consent. Sexual misconduct. Behavioral patients sometimes accuse EMS providers of sexual misconduct. Have a same-sex provider attend to patient. For aggressive or violent patients, make sure law enforcement officer accompanies you to the hospital. They protect you and the patient. In the event of a legal problem, they can serve as a third-party witness. Chapter review. All right. As an EMT, you will respond to many behavioral emergencies. Be sure to ensure your own safety before entering the scene or caring for a violent or potentially violent patient. A considerable portion of the population has a diagnosable psychiatric condition. However, not all patients are violent. It is important to remember that patients in crisis are patients and people who need your compassion as well as your care. Always consider patients acting in an unusual or bizarre fashion to be experiencing an altered mental status. This will help you to avoid overlooking a medical or traumatic cause for the patient's problem. Because treatment of these patients usually requires long-term management, little medical intervention can be done in an acute psychiatric situation. However, the way you interact with a patient during the emergency and assesses your patient throughout the call is crucial for the patient's continued well-being. Remember, safety is the first priority when approaching a patient with an altered mental status. Psychiatric and behavioral emergencies are prevalent in our society. EMTs should treat them as they would any other potential life-threatening disorder. Assessment of altered mental status should rule out physical causes first. Psychiatric and behavioral emergencies can present differently depending upon disorder. There are best practices EMTs employ in approaching, assessing, and treating such patients. Follow local protocols and use appropriate procedures to restrain patients when necessary. Some questions to consider. What methods can help calm the patient suffering a behavioral or psychiatric emergency? What can you do when scene size-up reveals it is too dangerous to approach the patient? What factors help assess the patient's risk for suicide? Some critical thinking. You respond to an intoxicated minor who is physically aggressive and threatens suicide, and whose parents permit you to treat but not transport the patient. How would you manage this patient? So that is the end of this chapter.